How is pulmonary hypertension diagnosed? First, provider will do a physical examination to check for signs of pulmonary hypertension as well as other heart or lung issues. During this exam, the provider will ask questions about the health and the medical history. Ask about the symptoms. Check the size of the veins in the neck. Bulging neck veins, that is jugular venous distension, could be a sign of right-sided heart failure. Check the size of the liver by feeling the upper right area of the tummy. Listen to the heart and lungs with a stethoscope. Look at the belly, ankles, and legs for edema. Measure the blood pressure. Measure the oxygen level in the blood using a pulse oximeter. Pulmonary hypertension can be difficult to diagnose since many signs of pulmonary hypertension are similar to those of other conditions. So after the physical exam, the provider may run some tests to get more information. The tests measure the blood pressure in the pulmonary arteries are Doppler echocardiogram, right heart catheterization. A Doppler echo uses sound waves to show how the right ventricle is working. It also measures blood flow through the heart walls. It allows the provider to calculate the systolic pulmonary artery pressure. Right heart catheterization is also known as pulmonary artery catheterization. If an echocardiogram shows pulmonary hypertension, this test may be done to confirm the diagnosis. It measures the pressure inside the pulmonary arteries and it checks how much blood the heart can pump per minute. During this procedure, cardiologist places a thin, flexible tube called a catheter into a blood vessel, usually in the neck. The catheter is generally inserted into the lower right heart chamber and the pulmonary artery. A doctor can then measure blood pressure in the main pulmonary arteries and the right ventricle. The tests look for the underlying cause of pulmonary hypertension, including blood tests. Blood tests check for a range of issues related to organ function, hormone levels, and infection. Specific blood tests include a complete metabolic panel and a complete blood count. Blood tests to look for blood clots, stress on the heart, or anemia. Blood tests can help find the cause of pulmonary hypertension or show signs of complication. Chest CT scan looks for blood clots or other lung conditions that may be causing the pulmonary hypertension or making it worse. Chest X-ray. It may be used to check for other lung conditions that can cause pulmonary hypertension. It shows if the right ventricle or pulmonary artery are bigger than they should be. Polysomnogram test. This is an overnight sleep test to check sleep apnea. Pulmonary ventilation or perfusion scan. In this test, a radioactive tracer is given through a vein. The tracer shows blood flow. Client also may breathe in a tracer that shows airflow to the lungs. This test can show whether blood clots in the lungs are causing symptoms of pulmonary hypertension. The provider may also perform a 6-minute walk test. This test shows how much exercise a person can handle and how much oxygen is circulating in the blood as client exercise. The results indicate if the pulmonary hypertension is mild or severe. Electrocardiogram. This simple test records the electrical activity of the heart. It can show changes in the heartbeat. This test may be done to help diagnose pulmonary hypertension or to determine how well treatments are working. Sometimes an echocardiogram is done while exercising on a stationary bike or treadmill to learn how activity affects the heart. If client has this test, the client may be asked to wear a mask that checks how well the heart and lungs use oxygen and carbon dioxide. Other tests may be done to check the condition of the lungs and pulmonary arteries are exercise stress test. This can show how the heart reacts to exercise. Computerized tomography or CT scan. This test uses X-rays to create cross-sectional images of specific parts of the body. Dye called contrast may be given into a vein to help the blood vessels show up more clearly on the images. A heart CT scan called a cardiac CT scan. It can show the size of the heart and any blockages in the pulmonary arteries. Heart imaging tests such as cardiac magnetic resonance imaging. This test uses magnetic field and radio waves to create detailed images of the heart. It can show blood flow in the pulmonary arteries and determine how well the right lower heart chamber is working. Lung function test. For this test, client blow into a special device. The device measures how much air the lungs can hold. It shows how air flows in and out of the lungs. Lung biopsy. A sample of tissue may be taken from the lung to check for a possible cause of pulmonary hypertension. Genetic testing. Screening for gene changes that cause pulmonary hypertension may be recommended. If client has these gene changes, other family members may need to be screened too. Next, we will see the treatment of pulmonary hypertension. Pulmonary hypertension cannot be cured, but treatment can reduce the symptoms and help manage the condition. Pulmonary hypertension usually gets worse over time. Left untreated, it may cause heart failure, which can be fatal. So it is important to start the treatment as soon as possible. If another condition is causing pulmonary hypertension, the underlying condition should be treated first. This can sometimes prevent the pulmonary arteries being permanently damaged. There are many treatments for pulmonary hypertension. Which treatment or combination of treatment depend on a number of factors, including what type of pulmonary hypertension the client has, the cause and the severity of the symptoms. Treatment for pulmonary hypertension caused by heart or lung problems focuses on managing the underlying conditions. Because so many different heart and lung conditions cause pulmonary hypertension, treatment plans can be vastly different from person to person. In general, the provider may recommend dietary changes, lifestyle changes, medications to manage problems like hypertension or heart failure, oxygen therapy, surgery such as heart valve repair. The last resort option for some people with a severe pulmonary hypertension is a lung transplant. The medicines may include medicines to relax blood vessels, also called vasodilators. These medicines help open narrow blood vessels and improve blood flow. The medicines come in many forms. It may be breathed in, taken by mouth, or given by IV. Some types are given continuously through a small pump attached to the body. Examples of vasodilators to treat pulmonary hypertension include epoprostenol, treprostinil, iloprost, selexipag, synthetic analogs of prostacyclin. These medicines dilate systemic and pulmonary arterial vasculature by promoting pulmonary vasodilation and reduce pulmonary vascular resistance. It relieves dyspnea and chest congestion. The drug may cause orthostatic hypotension. Do not give to the patients with systolic BP less than 85 mmHg. Given for patients who do not respond to calcium channel blockers or have NYHA class 3 or 4 right-sided heart failure. Next drug is soluble guanylate cyclase stimulators. This type of medicines relaxes the pulmonary arteries and lowers pressure in the lungs. Examples include riociguat. If the patient is pregnant, do not give these medicines. Next medicine is to widen blood vessels. Medicines also called endothelin receptor antagonist. It reverses the effect of a substance in the walls of blood vessels that cause them to narrow. Such medicines include bosentan, macitentan, ambrisentan. This drug may improve energy level and symptoms. Do not take these medicines if the patient is pregnant. The drug binds to endothelin-1 receptors and blocks the constriction of pulmonary arteries. It promotes relaxation of pulmonary arteries and decreases pulmonary artery pressure. This drug is given orally. This is given for patients with the New York Heart Association class 2 to 4 symptoms. This drug may cause hepatotoxicity, so that we have to check for liver function tests monthly. Next, medicines to increase the blood flow. It is also called phosphodiesterase 5 inhibitors, may be used to increase blood flow through the lungs. These medicines also are used to treat erectile dysfunction. They include sildenafil, tadalafil. It promotes smooth muscle relaxation in lung vasculature. It is given orally. It is contraindicated in patients taking nitroglycerin since it may cause refractory hypotension. Next drug is high-dose calcium channel blockers. These medicines help relax the muscles in the walls of the blood vessels. They include amlodipine, diltiazem, nifedipine. Although calcium channel blockers can be effective, only a small number of people with pulmonary hypertension improve while taking them. These drugs act on vascular smooth muscle, causing dilation. It lowers pulmonary artery pressure. This drug is given to the patients who do not have right-sided heart failure. Next medicines are blood thinners, also called anticoagulants. These medicines help prevent clots. One example is warfarin. Blood thinning medicines slow the clotting process. The medicines can increase the risk of bleeding. This is especially true if client is having surgery or procedure that enters the body or create an opening in the skin. Next drug of choice is digoxin. These medicines helps the heart beat stronger and pump more blood. It can help control irregular heartbeats. These drugs can improve the symptoms by strengthening the heart muscle contractions and slowing down the heart rate. Next is water pills, also called diuretics. These medicines help the kidneys remove excess fluid from the body caused by heart failure. This reduces the amount of work the heart has to do. Diuretics also may be used to reduce fluid buildup in the lungs, legs, and belly area. Oxygen therapy. Breathing pure oxygen is sometimes recommended as a treatment for pulmonary hypertension. This treatment may be suggested if clients live at a high altitude or have sleep apnea. Some people with pulmonary hypertension need oxygen therapy all time. Home oxygen therapy involves inhaling air that contains a higher concentration of oxygen than normal. If medicines do not help control the symptoms of pulmonary hypertension, surgery may be recommended. Surgeries and procedures to treat pulmonary hypertension may include pulmonary endarterectomy. This is an operation to remove old blood clots from the pulmonary arteries in the lungs in people with chronic thromboembolic pulmonary hypertension. Next procedure is balloon pulmonary angioplasty. It is a new procedure where a tiny balloon is guided into the arteries and inflated for a few seconds to push the blockage aside and restore blood flow to the lung. It may be considered if pulmonary endarterectomy is not suitable and has been shown to lower blood pressure in the lung arteries, improve breathing, and increase the ability to exercise. Next procedure is atrial septostomy. This treatment may be recommended if medicines don't control pulmonary hypertension symptoms. In an atrial septostomy, a doctor creates an opening between the left and right atria of the heart using a cardiac catheter, a thin, flexible tube inserted into the heart's chambers or blood vessels. It reduces the pressure in the right side of the heart so the heart can pump more efficiently and the blood flow to the lungs can be improved. The opening reduces the pressure on the right side of the heart. Potential complications include irregular heartbeats called arrhythmias. Last procedure is lung transplant. This type of surgery is rarely used because effective medicines is available. In severe cases, a lung or heart-lung transplant may be needed, especially for younger people who have idiopathic pulmonary hypertension. After a transplant, medicines must be taken for life to help reduce the chance of rejection. Pulmonary hypertension treatment depends on the type of pulmonary hypertension the client has and the other medical conditions. The healthcare team will tailor treatment to the individual needs. Right now, only two types of pulmonary hypertension can be treated directly. They are pulmonary artery hypertension, chronic thromboembolic pulmonary hypertension. Treatment for pulmonary arterial hypertension includes calcium channel blockers, diuretics, oxygen therapy, pulmonary vasodilators. Treatment for CTEPH includes anticoagulants. Medication include a soluble guanylate cyclase stimulator, balloon atrial septostomy, balloon pulmonary angioplasty, pulmonary endarterectomy. It is not always possible to prevent pulmonary hypertension. Some risk factors are out of the control. If client has risk factors, the provider may recommend preventive screening to check the heart and lung function. Doing whatever the client can to prevent or manage other medical conditions can help lower the risk of pulmonary hypertension. Steps a person can take include: create a safe exercise plan, follow a heart-healthy diet, avoid processed foods, fast food and other foods high in salt and saturated fat, quit smoking and stop using tobacco, take medications for blood pressure and other conditions as prescribed. Potential complications of pulmonary hypertension include right-sided heart enlargement and heart failure, blood clots, irregular heartbeats, bleeding in the lungs, pregnancy complications, heart failure, liver damage, pericardial effusion. No matter the cause, untreated pulmonary hypertension is life-threatening. So, it is essential that are diagnosed and treated as early as possible.